There are many amazing organs in the body that are vital for proper functioning. Some obvious ones are the brain, kidneys, the liver, lungs, and of course, the pump that keeps all those other organs alive, the heart. Unfortunately, the most common cause of death is heart disease. So today we're going to talk about the disease that most commonly affects the heart and how this disease can result in death and disability. But more importantly, discuss practical things you can do to reduce your risk of dying or being disabled from this heart disease. So let's get pumping. And a special thanks to Let's Get Checked for sponsoring today's video. So as I'm sure many of you are aware, the heart is located in the chest or thoracic cavity. It sits in this really cool sac called the pericardium, which lubricates the heart and helps anchor and protect it. And we have a more detailed video on the pericardium that I'll link at the end of this video. But let's take a look at the heart outside of the body so that we can get a better understanding of the area that is affected in the most common type of heart disease. Here you can see we've removed the outer layer of the heart so that we can see the myocardium, or the heart muscle itself. And the heart muscle is what does the majority of the work for the heart as it contracts and pumps the blood. And unfortunately, this is the tissue or the area of the heart that gets damaged as a result of the most common type of heart disease. The most common type of heart disease is coronary artery disease. Now, most of the time, you probably don't refer to it as coronary artery disease. You might say something like, Uncle Bob has high cholesterol and plaques in his arteries. Or the teens or youths these days may say something like, Uncle Bob's coronary arteries are sus, bro. But I'm sorry, I've digressed to using teenage vernacular here. But coronary artery disease is due to atherosclerosis, which is a buildup of plaque in the wall of the artery. And in this case, the coronary arteries that feed the heart muscle itself. And what is concerning about this is that the beginning stages of arterial plaque development can start as early as someone's teens. And there have been multiple studies that show this. For example, in an autopsy study of 2,876 men and women, ages 15 to 34 that died from non-cardiac causes, all of them were found to have aortic fatty streaks. If you haven't heard of fatty streaks before, a fatty streak is a lesion on the inside lining of the artery and is one of the beginning stages of plaque development. Now, I'm certainly not saying that you're likely to keel over from heart disease in your teens or 20s, but what I think is important to gather from this is that we generally don't think about plaque development and heart disease or even get concerned about it until later on in our lives, which I think is doing ourselves a bit of a disservice. And we'll get a little bit more into this when we talk more specifically about prevention. But the buildup of plaque in the coronary arteries typically is a slow, insidious process that goes on and can progress for years, and people are typically unaware of this because most people don't experience any symptoms from this process until the vessel is significantly blocked or occluded. Now, unfortunately for some people, the first clue that they have coronary artery disease is a myocardial infarction, aka a heart attack. But for others, they can have some symptoms that precede a heart attack, some of which include chest pain or chest discomfort, and often this chest pain can be predictable, meaning like the chest pain comes on when the demand on the heart goes up with exertion that occurs during physical activity, and then the pain is relieved with rest. Some people also have pain that radiates to the arms and shoulders and even the jaw. They may experience weakness, lightheadedness, nausea, cold sweats, and even shortness of breath. But again, if someone is experiencing symptoms due to coronary artery disease, or sadly even a heart attack, the disease has already progressed. So now, this is where we are going to talk prevention. One of the main things we can do to help slow the progression of plaque formation and to decrease our risk of serious cardiac events, such as a heart attack, is to monitor blood cholesterol levels and lower those levels with lifestyle modifications and/or medications when appropriate. And one option for getting this testing done is with the sponsor of today's video, Let's Get Checked. Let's Get Checked is a virtual care company that helps people to manage their health from home. And one of the ways they do this is by sending you a testing kit. Once you receive the testing kit, you can gather the specimen at your house, send it back to them, and they'll give you the results. Now, I do want to mention that about 3 years ago, I probably would have been a bit more resistant to a sponsor like this because I was a bit resistant to virtual healthcare. But since we've implemented virtual visits in the urgent cares that I work at, and I've used it with my own patients, I've definitely changed my stance on this, especially when patients don't have easy access to their primary care provider, or maybe the next available appointment is months out. So one of their tests that is relevant to our discussion today is their test on cholesterol. And the cholesterol test measures triglycerides, HDLs, LDLs, and they recently added lipoprotein A. You may have heard of this called as Lp(a), which is mainly determined by genetics, and elevated levels of this increases the risk of coronary artery disease. So again, getting info on these levels can help one to be more proactive and mitigate these risks. So if you're interested, visit the link in the description and use our coupon code IOHA25 to get 25% off your tests. We'll also include that information in the description below. So what can you do to reduce your risk of developing plaques and therefore coronary artery disease? Well, the biggest players that we will discuss are obviously cholesterol, but also blood pressure, smoking, and even diabetes. Now, diet and exercise will have a big impact on all of these. Well, not so much smoking per se, as that is more just about avoiding smoking altogether. But diet and exercise can definitely influence blood pressure, diabetes, and cholesterol. So we'll definitely give you some tips and guidelines for how you can utilize diet and exercise in your overall risk reduction. But starting with cholesterol. Certain cholesterol is known to be atherogenic, or in other words, can cause atherosclerosis or plaque development. You have likely heard of LDL cholesterol and HDL cholesterol. LDL cholesterol is atherogenic, whereas HDL cholesterol has anti-atherogenic properties. And this is why you often hear this description of HDL being good cholesterol and LDL being bad cholesterol, which is a bit of an oversimplification and probably isn't the best way to describe them. But without getting too lost in the weeds, a quick synopsis of how cholesterol causes atherosclerosis and leads to coronary artery disease is that the inside lining of the artery, called the endothelium, gets irritated or injured. And as we're going to see, this injury can occur from elevated lipids in the blood, smoking, high blood pressure, and diabetes. But once that epithelium, or that endothelium I should say, gets damaged, then things can start to stick to and penetrate it, like LDL cholesterol. The LDL cholesterol gets oxidized and taken up by white blood cells called macrophages, which then are referred to as foam cells because they have this bubbly or foamy appearance the more and more LDL cholesterol they take up. And then through a series of additional steps, and I admit for the diehards I am simplifying this a little bit, these macrophages and the engulfed LDLs get built into the wall of the artery, forming a plaque. So maintaining proper LDL cholesterol levels or reducing your LDL cholesterol if it's too high can help limit or slow this process and therefore reduce your risk of negative events related to coronary artery disease, such as heart attacks. And most recommendations are to keep your LDL cholesterol below 100 milligrams per deciliter. But some clinicians are even more aggressive than this depending on the patient, such as age, their current risk factors, and their current state of health. And as I already implied, interpreting cholesterol is a bit more nuanced than just looking at HDL versus LDL, good cholesterol versus bad cholesterol, especially if we get into things like ApoB and lipoprotein A, for example. But those details are worth a whole video of its own, so that will definitely be coming. But the key is managing cholesterol that is atherogenic. And for most, regardless if we get lost in the details of the different cholesterol carriers, the management or treatment of elevations in atherogenic cholesterol is going to be the same for the most part. And moving on to blood pressure. Hypertension or high blood pressure can create a mechanical irritation to the endothelium, which would make it more susceptible to cholesterol and plaque formation. This is another condition that people can be walking around with and have no idea, because symptoms of high blood pressure don't typically become apparent until it is much too high. Ideally, you want to keep your blood pressure below 120/80, and proper measuring of blood pressure is important, but unfortunately, blood pressure is often not taken correctly. The correct way to do it is you want to be sitting and relaxing in a chair with the back supported, legs uncrossed with both feet on the floor, and the arm that is being used should be supported at the level of the heart. And you would want to be sitting and relaxing in this position for about 5 minutes before measuring the blood pressure. Smoking can also cause irritation and damage to the endothelium of the artery, but this would be more of a chemical irritation as compared to a mechanical irritation that we saw with high blood pressure. But this would also make the artery more susceptible to cholesterol and plaque formation. And there isn't much more to say about smoking other than the best thing you can do is just to avoid smoking, and there are obviously also other risks to smoking such as lung cancer. Now, we can acknowledge that there are some people who smoke and don't die from coronary artery disease or lung cancer, but they kind of just survive those conditions in spite of the smoking. But if you pull all of the data together over the general population, it is absolutely clear that smoking is a huge risk factor for the development of coronary artery disease. The excess glucose circulating in the blood in someone with unmanaged diabetes can also irritate the inside lining of the arteries, which I sound like a bit of a broken record here, but again, making the artery more susceptible to plaque development and therefore coronary artery disease. But this isn't the only problem, because diabetes also affects how the body processes and utilizes carbohydrates and lipids, which has a negative effect on cholesterol and triglyceride levels. And triglycerides are another type of fat that are related to and influence LDL cholesterol. And in general, those that have unmanaged type 2 diabetes have elevated triglycerides, elevated LDL cholesterol, and low HDL cholesterol. Now, before we get into diet and exercise, I do want to clarify the result that we don't want. I've mentioned that people don't get symptoms of coronary artery disease until the disease has progressed, usually for many years. And what causes the symptoms is that the blockage from the plaque in the blood vessel gets large enough so that the tissues downstream from the blockage don't get enough blood. And in the case of the coronary artery disease, we're talking about the myocardium of the heart. A heart attack usually occurs when the plaque suddenly ruptures, and then a clot forms due to that rupturing, and this quickly blocks the coronary artery even further, and then the heart muscle doesn't get enough blood, even at rest, causing the symptoms of a heart attack and the death of cardiac muscle tissue. And the outcome of this depends on how much of the heart muscle is affected and how quickly intervention takes place. But let's move on to the positive. What can you do to reduce your risk of coronary artery disease? Well, in a way, we kind of just need to do things to manage those 4 big players that we just talked about. Avoid smoking, manage cholesterol, blood pressure, and diabetes. It's just so simple, right? Well, sarcasm aside, in some ways there is some simplicity to how to manage this. For example, both diet and exercise can improve cholesterol, lower blood pressure, and improve insulin sensitivity with diabetes simultaneously, getting you a better bang for buck, so to speak. So what's the best form of exercise for this? Now, I'm always going to be a proponent for mixing in strength training to everybody's workout routine, but the most effective type of exercise for improving cholesterol, high blood pressure, and diabetes, and again, the main topic of the video, reducing your overall risk of coronary artery disease, is cardiovascular exercise. And one of the best ways to do this would be steady state cardio for 2 to 4 hours a week. And the closer I can get my patients to 4 hours a week, the happier I am. But this form of steady state cardio would be at a moderate level of intensity, where you could still have a conversation with someone on the phone, but they would definitely know that you were exercising. You could run, hike, swim, bike, row. You can do all sorts of different things to get into this steady state cardio or the zone 2. But I actually have a specific video on this type of training that I'll link at the end of the video if you want more details on how to do this. Now, diet is such an interesting topic. Like, we'll get into debates and disagreements with people about the nuances of exercise routines here and there, but it doesn't seem to be nearly as intense or crazy as how people can get with their diets. With that being said, I'm one of those that believes there's not one perfect diet for every single person. The human body has the ability to consume and utilize a variety of different foods and still maintain great health. However, there are some staples and some general principles that I think can be applied to most people. For example, observational studies have consistently shown that individuals consuming diets high in vegetables and fruits, such as the Mediterranean diet, for example, have a reduced risk of cardiovascular disease. Again, I'm not saying you have to go full Mediterranean, it's just one positive example. But here are the staples and general principles. Those that eat a diet rich in fruits and vegetables, fibers, limit their sugar intake, eat more monounsaturated fat rather than trans fat and saturated fats, and even consume omega-3 fatty acids, tend to have lower risk of coronary artery disease because these dietary principles can help improve cholesterol, blood pressure, and diabetes, or the risk of getting diabetes in the first place. And obviously, maintaining energy balance with your diet is very important, meaning not consuming more calories than you are burning, or if you are trying to lose weight, having a caloric deficit. And I do need to mention that for many people, diet and exercise or lifestyle modifications alone may not be enough to substantially reduce one's risk. And so that is when management with medications will come into play, such as statins to help lower cholesterol, blood pressure medications, and even diabetic medications like metformin. But this would obviously be something that you would do in conjunction with your healthcare provider. Thanks for supporting the channel, everyone. Let us know what you thought of the video in the comments. If you want to learn more about Zone 2 or another heart video, we have those linked here, probably somewhere on the left. And if you're interested in the tests offered by Let's Get Checked, that info is also in the description. And we'll see you soon.